Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about migraines. In particular, I will cover what is migraine, how do you treat migraines, and how you can more successfully live with migraines. So we start with what it is. Migraines are chronic headaches that can cause significant pain for hours or even days. Symptoms can be so severe that all you think about is finding a dark, quiet place to lie down. Some migraines are preceded or accompanied by sensory warning symptoms or signs, such as auras, flashes of light, and blind spots or tingling in your arm or leg. A migraine is often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. There are two types of migraine, classical and common. Classical migraine is when the headache follows a series of symptoms known as aura. Common migraine is when a person does not experience aura symptoms. The main symptom of a migraine is intense headache. This usually occurs at the front or on one side of the head. However, during a migraine attack, the area of pain can sometimes change position. The pain can feel like a throbbing sensation, and it can be moderate or severe. The throbbing is usually made worse when you move. Classical migraine symptoms with aura. An aura means a warning sign. It is the name that is used to describe the symptoms that you experience before the migraine begins. Around 1 in 4 people who experience migraines have additional aura symptoms. These can include visual problems. You may experience visual disturbances such as flashing lights, zigzag patterns, blind spots, and other visual distortions. And stiffness. You may have stiffness or a tingling sensation like pins and needles in your neck, shoulders, or limbs. And also have problems with coordination. You may feel disorientated or off balance and difficulty speaking. You may find it difficult to express yourself properly using words. And also a loss of consciousness. This only happens in very rare cases. The aura symptoms typically start between 15 minutes and 1 hour before the headache begins. Some people may experience aura with only a very mild headache. Some migraine symptoms then. The symptoms associated with a common migraine include nausea. So you may feel queasy and sick. This may sometimes be followed by vomiting. An increased sensitivity. You may experience photophobia, which is sensitivity to light, and phonophobia, which is a sensitivity to sound, and osmophobia, which is a sensitivity to smells. So this is why many people who have migraine want to rest in quiet, dark rooms. The symptoms of a common migraine often begin at the same time as the headache. However, these symptoms will usually disappear once the headache eases. It is thought that migraines may be caused by changes in the chemicals of the brain, in particular the level of serotonin. The low levels of serotonin can make the blood vessels in part of your brain spasm, which makes them narrower. This may cause the symptoms of aura. Soon after, the blood vessels then dilate or widen, which is thought to be the cause of the headache. So, however, the exact cause of the drop in serotonin levels is not fully understood. So next is, how do you treat migraine? Pain relieving medications. So for best results, take pain relieving drugs as soon as you experience signs or symptoms of a migraine. It may help if you rest or sleep in a dark room after taking them. So nonsteroidal anti-inflammatory drugs. These medicines, such as Nurofen or aspirin, may help relieve mild migraines. If taken too long or too often of periods of time, NSAIDs, the nonsteroidals, can lead to ulcers, gastrointestinal bleeding, and rebound headaches. Next is triptans. For many people with severe migraine attacks, triptans are the drug of choice. They are effective in relieving the pain, nausea, and sensitivity to light and sound that are associated with migraine. And the medications include Imigran, Zomig, and Fovex. The side effects of triptans include nausea, dizziness, and muscle weakness. They aren't recommended for people at risk of strokes or heart attacks. And next would be ergot. or ergotamine, is much less expensive but also less effective than triptans. It seems most effective in those whose pain lasts for more than 48 hours. And also anti-nausea medicines, because migraine attacks are often accompanied by nausea, with or without vomiting. Medication for nausea is appropriate and is usually combined with other medications. Some frequently prescribed medicines are Maxolon or Stemetil. And next would be opioids. These medications containing narcotics, particularly codeine, are sometimes used to treat migraine pain when people can't take triptans. So Migrelieve contains paracetamol, codeine, and an anti-nausea medication called buclizine. Narcotics are habit-forming and are usually used only as a last resort. And finally, how do you live with migraines? Migraines are never welcome, but they can cause special difficulties when they strike at work or school. Embarrassment, reduced productivity, and less than supportive employers or co-workers are just some of the potential problems of migraine that occurs during the workday. The best way to prepare is a three-pronged strategy that includes trigger avoidance, early symptom identification, and a good action plan. So avoid triggers. By keeping a diary, you will come to learn your triggers and avoid them. Learn early identification of any headaches or warning signs. You will also come to recognize the signs that a headache is coming, which will enable you to take action quickly. Create a good action plan. Know what you're going to do before a headache happens. Have medications or anything you use to relieve a headache close at hand. And finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you in managing migraine more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as exercise ball, floor mats, weights, and various other items to get you up and running on a program that we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without prescription, such as Migraine, vitamin B, Anti-Nausea Medicine, cold packs and hot packs. Plus we stock light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic, which you can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing migraines with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.